watching this film, then you probably have a child or several children in your class who are either experiencing symptoms of post-traumatic stress disorder, PTSD, or have a known diagnosis of PTSD. After experiencing or witnessing a traumatic event, such as a car accident or an act of violence, it's normal for children to experience symptoms of post-traumatic stress for a short period of time. Common symptoms of PTSD include children experiencing unwanted intrusive memories, thoughts or images of the traumatic event, avoiding reminders of what happened, or even avoiding talking or thinking about what happened, seeming more on edge and jumpy, being more easily irritated or angered, and struggling to concentrate. Here are some tips you can apply in the classroom straight away that may help to support children and their learning. Tip 1. Respond to distress in the moment. Children who've experienced traumatic events can be easily triggered. Grounding and mindfulness techniques can be used to connect children to the here and now. A really simple one, for example, is 5, 4, 3, 2, 1, where you encourage children to say 5 things they can see, 4 things they can feel, 3 things they can hear, 2 things they can smell, and 1 thing they can taste. You can do this as a whole class to avoid singling out children who've experienced a trauma. Tip 2. Offer children the opportunity to speak about what's distressing them when they're calm. It's often thought that discussing traumatic events can make PTSD symptoms worse. However, evidence suggests the opposite is true. Be sure to show that you've listened to them. Check your understanding of what they're saying and validate their emotions. Reinforce what is known now, that the traumatic event has come to an end and that the child is safe. Tip 3. Set clear and consistent expectations of behaviour as well as consequences for not following them. Higher levels of irritability, anger and aggression are some of the most common symptoms of post-traumatic stress. The emphasis of the expectations should be on what you want to see. For example, kind hands rather than what you do not want to see. For example, hitting others. Acknowledge, praise and reward them for following class rules and using coping strategies. Tip 4. Stick to routines. Routines make children's days more predictable and enhances their sense of safety. Explain any changes that occur visually and verbally. Encourage children to continue to engage in previously enjoyed activities even if they don't feel like it. Tip 5. Regular and consistent communication with parents and carers is key. Plan a meeting with the school SENCO and the parents and carers to discuss your concerns as early as possible. Ask parents and carers about known triggers and techniques that they're using to manage symptoms at home and share your own tips. Bear in mind that depending on the traumatic event, parents could be traumatised themselves. It's also possible that the threat is ongoing, and so it'll be important to liaise with relevant professionals. If you have any safeguarding concerns, discuss them with your designated safeguarding lead. Thank you for taking the time to watch. Your dedication and care will be making a big difference to children you're hoping to support. For further, more detailed guidance on how to support children with PTSD, please download the fact sheet.